think, where we're getting some attention, Mayor Warren did bring up there's some significant inequalities in terms of both the race and ethnicity of people who are in the hospital and people who are in the ICU. And there's significant inequality in the Black and African American communities in terms of the percentage of those people who are really sick. So I think that has kind of sparked some of the conversation around, basically healthcare inequalities for people of color, and also I think even specifically people who live within the city of Rochester themselves.
Thank you, Jackie. When we talk about the racial disparity, we see you in the community so often. We see you so much, and what are some of your take on this as far as this racial disparity? Are you seeing more of a response now? Are you seeing other communities? Because we see you a lot. And so are we starting to see now other communities starting to come and couple together to get this information out?
So I don't think we're seeing anything different.
Okay.
I think that the racial disparities have exist and still exist. As Dr. Berenbaum mentioned, this is addition to what's happening with the racial divide and the disparities in our communities, because we know that we are, Black and brown people are disproportionately impacted. So this is just another divide, if you will, with the disparities that are already in place.
All right. Now, when we hear, thank you so much for those answers. When we hear Trillium Health, we immediately think HIV testing. We immediately think these things. But now we see that this COVID-19 is establishing not just for HIV testing, but we also have a COVID-19 hotline number that will increase the access of some of the communities that have been overlooked. Can you tell us a little bit more about that?
Absolutely. I think, to your point, a lot of times when people hear Trillium, they hear HIV positive, and that kind of rings true. And I think one of the things that's important is when we look at our total number of patients, which is probably around 12,000, we only have about 850 HIV positive patients. So most of our patients are HIV negative. Most are receiving primary care. Mm-hmm. So one of the things that we realized, and in partnership with the community and like our county executive said, it's kind of been a call to arms for a lot of us who have locations within the city of Rochester. Because what we're starting to realize, and this has happened while I've been taking care of patients via video visits at home, I may have a patient who lives in the city who I'm concerned about that has respiratory symptoms. And I'm talking to them on the phone. They're not sick enough where I want to send them to the hospital, but I really want to get them tested. So up until now, coming up next week, I would have to call one of the health systems, go through their hotline, give the information, and then try to figure out how my patient who lives in the city of Rochester is going to have to take two buses to get into the suburbs.
Right.
To get tested. And that is an inequality. And that is not okay. And so our hotline, which starts next week, will allow not only obviously Trillium patients, but starting next Thursday, anyone in the community who has a lack of access to healthcare, no primary care, no ability to feel that they can get information and be able to go to a location like Trillium, which is on a bus line or just outside of different neighborhoods. It allows people to speak to a nurse on a hotline, and then if the nurse and the patient feel like the person needs to come in, we're setting up an entire respiratory evaluation unit that's being run by physicians, nurse practitioners, physician assistants, so they can see a medical provider and get an evaluation. And does that mean that everyone is going to be tested? Nope. Some people may not need to be tested. But I think about the patient that I couldn't get testing because I couldn't get them there. that person, at least seeing a medical provider, being able to have their lungs listened to, an evaluation puts people more at ease. And as a medical provider who's my proportion of patients all live in the city of Rochester, it puts me at ease that I feel like we're able to, at least in a little bit, because I still think there's significant, disparities in healthcare.
Yeah.
Maybe remove that barrier. And I think that's really critically important.
Right, because there's a lot of people that live in urban, populated or saturated areas that do not have access to transportation.
Exactly.
And so we see these things, and there are also people who are underinsured as well. And so we are so thankful that Trillium is reaching into this community and making itself available for those people to remove those barriers of transportation and not having a regular provider. So now there's no excuse for people. But you did say one other thing about not these. I heard on the news, which confused me, which is why I wanted to make sure we all got clarity about this. Oh, Trillium is bringing respirators into the neighborhoods. And so we're like, oh, yay, respirators. But then we see Governor Cuomo and President Trump, and they're like, we don't have enough respirators, and we need to send 400 to Massachusetts. And so can you just give us a little bit more of information on this respirator thing? Are people able to just walk in and, walk up to a machine?
So, I always, it's one of those things that that term now has become this like scary term, because everyone's like, oh my God, we don't have enough, ventilators or respirators. But, as an outpatient center, that hotline, which is so critical for people to call first, because, what we're hearing across the country, and specifically places that really primarily take care of people in urban populations, is by having people have the ability to talk to a registered nurse. Often that phone call is all that is needed, because people receive information that they need, or if they need an evaluation. For us as an outpatient center, obviously we're not going to put someone on a respirator or a ventilator. One thing that we can do, though, is we would be able to evaluate people. And let's say we evaluate someone and we feel that they need to be tested, which is a deep swab, all the way up their nose it's always got to pre-warn people. It's a Q-tip that goes up your nose.
Oh my gosh.
But we would be able to test people and within generally about 48 hours get a result back. But I think the other advantage we have is to your point, people are, the other big thing is people are afraid to go to hospitals right now. And I'm hearing that often because they're afraid that they're going to get sick. And there's a lot of fear because, I think our media is trying to do the best they can to educate, hearing that, you look at New York City where, tens of thousands of people have died, and, around the country where more than 50,000 people have died, and we just keep hearing death. And that scares people. And they keep hearing hospitals have these horribly sick people. And we see doctors and nurses wearing, full personal protective
hazmat suits.
Exactly. So I think one of the nice things about it is having a clinic like ours that can set up its own unit. We can evaluate people. And then let's say I'm evaluating someone and I feel they have to go to a hospital. There's a human ability to be with someone, to have that conversation and allay people's fears. And I think trying to have people be able to do that by themselves, or listen to what's going on the news and hear that, to your point, Governor Cuomo saying, oh my God, we're going to be short ventilators. And the president saying, well, you should have done this yourself, or I'm going to send you 400. People feel like if they go to a hospital, they'll automatically be put on something like that. And I think our unit, our evaluation area is going to be able to allay fear as well. And I think that's really important right now.
Yes, I agree. I believe that there is a lot of the underlying mental health that is affected by this type of crisis that is happening in our communities, and a lot of the I would say cultural opinion.
Yep.
For certain people, some people say, oh yeah, there's a hospital, like I've seen hospitals on Irondequoit, they have a walk-in treatment center. I think it's on Culver, and then they have a, it's right near, the hospital is not too far on Portland. But then when you come into more urban communities, we see that, a little more spread out and it's not as accessible. What I hear you saying is that you all are putting that buffer between someone self-diagnosing and then someone going straight to the hospital where there's this fear that they could be exposed because there's a lack of social distancing. So I hear you saying that Trillium is kind of putting that buffer, that in-between space, so that people can have some form of relief and also some form of a mental calmness as far as this concerned. Am I hitting that right?
Absolutely. And I think you hit something that's really important. And I've been doing, actually every one of the providers, medical providers, have been doing video visits for a month now. And sometimes I'll be on a video visit and I can tell one of my patients' anxiety is here. They're so anxious about this. I've had patients tell me they've left the house 2 times in a month, and that's not healthy. And
right.
sometimes just, and this may happen on the hotline, just talking to a nurse to say, it's okay to go for a walk. Mm-hmm. Being outside is healthy. Especially today, the sun is out. Yes. People should sit outside as much as they can. Obviously, we want social distancing, but to coop people up inside, for people who already may have some mental health issues, this is making things worse. And so I think the hotline is also going to be very helpful in that sense to answer questions for people who may not be sick, people who may just want to call in and say, I'm worried to go for a walk. Mm-hmm. And I think it's really important for our community and the county to be able to, not only us, but Jordan has a hotline that's up as well, to be able to answer things that even go beyond the medical with this, because there is a very big psychological component here.
Yes, very much so. Very much so. I've heard terms such as sun deprivation, cabin fever. There are certain things that really take a toll on mental health as far as the community. And if you're already struggling, we don't want to get too far. Of course, we want to talk more about this COVID-19 and what Trillium is doing. But I thank you for putting that out there, that even if we have, I'm going to put the hotline back up just so people can see that again. Even if they are having anxiety about leaving the house, even if they're having some form of triggering with some type of mental something that's just happening, where they're just afraid, or this fear that happens to us as far as going out of the house and what to do if they come across somebody who they're feeling like they're exposed. What can they do? I believe that it's very important for them to get that information and make an informed decision. And a lot of things, I remember I used to watch G.I. Joe a long time ago, and what it would say is knowing is half the battle. And so we want to just thank you for saying, for giving us this. So let's look at this, the outlook for the future. Where is this really going? I'm starting to see more opportunities for telemedicine. We're doing the telecalls and call-ins and things of that nature. We have a lot of people who have been marginalized in these healthcare systems. We've talked about that. Usually government-funded programs help to offset the cost. We've talked about people being underinsured. However, when we couple all of these factors in a crisis with a population that is saturated with people with compromised immunity, and once again, that's kind of going back to when people hear Trillium, when they see Trillium, they think, this is, the HIV, these are the people who take care of people who are HIV positive. And so we should think along those lines, because you have to think there are a lot of people who have compromised immunity. But however, we've made the point, just for people who are just now tuning in, that Trillium is not just isolated to just the HIV community, but Trillium is also helping in other areas. So if you would like to give us, for the people who are just tuning in, a few of those other areas. Once again, we have the crisis hotline number that is up, and if you would like to give us a few of those other areas, how Trillium is helping to meet those needs. We have the COVID-19 testing. Yep. We have the if you don't have a regular healthcare provider, that you can give the hotline a call and they can get you started there. But what should we be doing to prepare ourselves for the long run. So what I'm trying to say here is the aftercare, because right now it's crisis care, right? So the aftercare, the long run, what other services can Trillium offer to this this community?
So, Trillium, we have 2 medical locations, one on Monroe Avenue and one on Science Parkway. So Trillium now provides primary care of all ages. So we have on Science Parkway, we have a pediatric office that has a number of board certified pediatricians. We have a gynecologic practice for people of every need that anybody could imagine we can do at the gynecologic practice. And then our Monroe office sees both primary care and specialty care. And our specialty care, we talked about, one thing is taking care of people living with HIV. We also do STD treatment and testing, but just primary care. And I think that's one of the big things when you're thinking about the what's next. So when COVID-19 starts to decrease and we start to see businesses open up, I think one thing we've learned during this is having the ability to do video visits saves people time. So one of my patients who normally takes 2 buses to get to me can just log on and I see them like I'm seeing you, and we can have a really good conversation about how they're doing with their diabetes. Hey, talk to me about what your blood sugars have been like. Hey, when's the last time you had some ice cream? Because I know you like ice cream. And we don't always have to do that in person. I think we're going to have learned from this experience that doing video visits for primary care is going to be removing a barrier for people who can't always come to the doctor's office, people who have to take time off their job to come to the doctors and lose wages. And that is something I think we're going to have learned from this experience, that we've always said, meet patients where they are. And I think this has taught us not only meet patients where they are, but do it in a way that's more convenient for them. And I think that is one of the biggest things we've learned during this time. I've had a number of patients who, live in the urban areas, the more urban areas of Rochester, say, hey, I know I need to see you 4 times a year because I have a lot of chronic medical conditions. Can 2 of those be this way? And I'm like, yeah, let's do that. This is amazing. And I think that's the one thing that we've learned and started to do very well. I mean, I am seeing as many, if not more, patients now via video than I did in the office. And it's faster for them, which is better and more efficient. And it's still very good healthcare.
Yeah. Yeah. I had a video call now. Here's the other thing. One of the barriers that I had was I didn't have an app on my phone or something like that I needed to try to do. So how easily accessible are these video apps? And, can we use them from our phones, from a text message? Do you have to have internet connection? Because we still have that barrier in many urban communities as well. So can you just explain a little bit about how Trillium, if you want to expand, of course, feel free, but how Trillium is offering that service?
So for us, if someone has video capability on their phone or any other device, we can send them a text link, and there is no application that's needed. It just, as soon as they click on that, I see that they're on, and I click on start video visit, and then hello, they're there. Or if they have an email account, we've even set people up who don't have email, or people who texting doesn't work when they're on Wi-Fi. So we've been able to set them up with email, so that launches. But I think you've hit on a really important piece, which is not everybody has internet. Right now in our community, spectrum for people who have kids and other families are able to get internet. And I think it's something that has been critically important at this time, but that we can't let go of, because internet is expensive. And yet again, let's put another barrier for our patient population when this is done, to then pull that away from them. And I think that's a mistake. I think that's something that I know we've talked about internally on. I have some concerns of patients who only can do this, to your point, because the internet is now free. And so we've started to think about what can we do in that situation? You know, what can partners like Spectrum do when this is done so that we don't lose this ability? Because I think this has taught us so much and has been able to have allowed us to reach farther than we've reached before in a way that is better for the people that we're taking care of. I feel like doctor's office often, we inconvenience people to get to healthcare, and that doesn't make sense. So I think there's a lot to have learned here, and I think the journey really has just started here.
Yeah, I agree, if I may chime in, because there is what we call a digital divide.
Yep.
You know, when it comes to the community, because there are still a lot of people who don't have Wi-Fi services or who don't have access to internet services, and that is a major problem right now, particularly with kids being out of school and needing to, you know, do homeschooling. So that digital divide is real.
Yeah, I agree with that. You know, there are some people who are privileged to be able to use the internet. We also I'm thankful to see that there are pediatrics. Now, I will tell you, just bear with me just briefly to let me tell you this part. So I've seen some kids that have gone to like places like Subway or wherever there's public Wi-Fi and things of that nature just to use their Wi-Fi. If they're, and one of the things about me, and I'll just say this to try to be honest and not put anybody in a awkward position, but domestic violence is a big issue that is very close to my heart. And there are some young people who are experiencing these domestic violence situations that are not offered access to the Wi-Fi. They're not offered. They don't have the means, and I mean this in a very short sense, the most sensitive sense of the word. They're not being allowed. I'll put it that way. You know, if anyone is in a domestic violence situation, even be it women, be it children, be it even men, because men go through domestic violence situations as well. Is there any type of resource where, you know, I mean, they may or may not have access to internet, but of course we said those text messages, but is there anything that Trillium also can help in that way if people are experiencing, and I know this is a little off, but in this COVID, it's related to COVID because we're all quarantined to our homes. And so if there was already a domestic violence situation present in the home where people had a way of escape by going to work, by going to school, by going to, you know, different places, what can you just speak to some of that? And then also one other thing, please, for my viewers, if you have a question, please post those questions because we have a few minutes here before we get off the line, but please post those questions also. And I'm sorry, I'm kind of losing my thought pattern here, but with those domestic violence situations, if you would please speak to some of that as far as what Trillium can do. And me being a womanist, I also include the men. Sometimes, you know, women get on and they're like, oh, this only happens to women and children. No, there are men who go through domestic violence situations from their spouses as well. So if you could just say a little bit about that, what Trillium is doing, or has a bridgeway or a buffer in that situation.
So we, you know, obviously as a healthcare provider, we do encounter this. And to your point, there has, at least in my limited experience during this, there seems to be an uptick in, and we're hearing that nationally in these situations, whether it's physical, mental abuse, because people are stuck in their homes. As a healthcare provider, we do partner with a lot of the areas around the community. So, you know, I think the most important one that if people don't know about is Willow. I think Willow is critically important, and they've done a lot of work during this time as well, as this is very different for them. So I know that a number of us have reached out to them during a time like this where there may have been some domestic violence in a home, and then when people are, to your point, feel like they're trapped.
Right.
Things have gotten worse. So Willow has been a phenomenal partner for us, and that is what they specialize in.
Awesome.
Yep.
Awesome. Thank you. So there are partnerships that exist. So just to our viewers and to anyone who may share this video, if you are experiencing something in a domestic violence situation, or if you know someone who is experiencing something in a domestic violence situation, we will put in the comment line or in the comment section of this video domestic violence. And then also, if you just don't have any other way, once again, I'm going to put the COVID-19 hotline. Is this safe to say that this is at least the number that everyone should call at first, because we don't want to overwhelm the system?
So I think if anybody has a concern regarding this, and I think this is the one thing that people are trying to figure out, we put this hotline in for anything related to COVID-19. And that doesn't always mean that I feel sick, meaning physically sick. They have questions, concerns, something is going on. If we can't solve it, and as healthcare providers, we're limited in solving some, but we do know the community resources, and we are very big advocates for our patients and people in the community. So if this is the number that someone uses and this is the entry into help, I'm all for that, because any entry into people getting whatever help they need is really important.
Thank you. Jackie, would you like, before we have a few more minutes here, we don't want to keep you all on the line. First of all, we want to just thank you all, thank you both, and also thank Lisa, who's behind the scenes doing a lot of the administrative work. We want to just give her a quick shout out. But Jackie, do you have anything else that you'd like to share with the people as a trusted voice, as a healthcare advocate in our community? Is there anything else that you would like to share? Just an empowering word, something that will just give the people some hope.
Yeah, just we're in this together. And so as a community, we need to come together, pay attention to what's going on, share information, make sure that your family and your friends and those individuals who are still not practicing social distancing, are getting the word and hearing what's going on. We have to mobilize the community. This is about us. And so we really, really have to come together and do what's right. This is just the beginning.
Yes.
The aftermath is going to be the toughest part of this. When, when things slow down, and people are going to need resources. And so we have to be in a position to be able to provide those services and resources for those individuals. And so we have to do this together. There's no other way. We've got to come together and do this. Yeah. So be safe, everyone. Thank you, Dr. DJ, for having us on. I really appreciate it. Great platform. And I hope some of this information has helped someone. So yes, thank you. Thank you, Dr. Barenbaum.
Of course. No, I thank you so much for having me on. It's an honor.
Wonderful.
I saw a couple questions.
Yeah, I did. Go ahead if you wanna. If you wanna. There was one on our Facebook, because we are streaming Facebook Live, and I'll just say her first initial TSC. I'll just say that. It says, can we call the hotline if we just feel isolated? That was one of the questions from our Facebook. So if you could just address that.
Sure. We have, for people who are feeling isolated and need someone to talk to, we also have therapists. So we have a general number as well, where we can get people in to talk to someone who is a professional at this. That number is 585-545-7200. And that's our main number. And we have psychologists, social workers. Sometimes a good primary care provider is somebody who can also talk to you about these things as well. And someone had messaged on the panel, are we taking new patients? We can see new patients very quickly, even by video visit as your first visit. So as far as I'm concerned, if people choose whatever number they want, we can get them the help they need, even if it's beyond just something, regarding the medical illness side of this.
Thank you. There was another question that I remember seeing it. I'm not sure, but I think it was asking about dental.
Yes.
Yeah. So could you?
Sure. So we do not do dental on site, but we have really great partners. And I think one of the things that's important, we're a federally qualified health center lookalike, which means we receive federal funding to take care of patients. That also means that financial barriers cannot exist. So we have really great dental partners that ensure that there are not financial barriers for people with dental needs, and we help arrange that as well. So we kind of become, and it's one thing I love about primary care. Primary care people are the captain of the ship, meaning if someone needs a dentist and we don't do it, we're going to make sure that they get in, or a specialist, we're going to make sure they get in, and that there are no financial barriers for people.
That's awesome. So you are the captain. You are the in between.
Yep.
You're just doing it all, and this is why it says primary care. Go here first. So we're going to put that hotline number up one more time. Again, I just want to thank you both, and even people who are behind the scenes who have all helped to make this broadcast possible. Thank you again for reaching back in after being reached out. Thank you so much, Dr. Berenbaum, and thank you so much, Jackie, for making yourselves available during this time. We're going to just see if there are any more questions before we get off the line, but we're putting up the COVID-19 hotline. If you are having any issues, if you are having any cough, any fever, there are they have telemedicine, they have primary care, they can get you to see a specialist. If you are experiencing cabin fever, if you're having any type of mental health issues, call this hotline. They can get you pointed in the right direction, and they are also local. And so if you need someone that is local within walking distance or within your community, there are places that are available, so you don't have to catch what we said 2 buses to try to get there. And so once again, I just want to thank you again, Dr. Berenbaum. I want to thank you again, Jackie Dozier, for just being the voice in our community. I want to just tell you, I love you both.
Thank you. Thank you. Love you.
And I hope to hear some more about what Trillium is doing. We also started a poll, so we're going to ask all of our people who are on our poll, if you could just please answer the poll, and we will talk some more about some more topics. We'll ask Jackie to come back on. We'll ask Dr. Berenbaum to come back on some of these topics about mental health and maybe economic disparity, and have some more dialogue and some more talk. So once again, I'm Dr. DJ Robinson. I hope that this has helped you today, and we will have more empowering conversations. Please do not hesitate to send your comments or questions in the comment box, or like, share, and subscribe to our webpage. You can also go to my webpage, drdjrobinson.com. I will have all of Trillium's information and their COVID-19 response on our community partners page. And if you would like to get any of that information, once again, you can call the number on the hotline and they will be able to point you in the right direction. So once again, I just want to say thank you so much for all of you who have participated, everyone who has